It's Sunday, August 17th, about 2:30 p.m. Pacific time, and I wanted to talk a little bit more about one of the conversations I had with a nurse at the protest in Newport, Oregon yesterday. While we were waving at cars and they were honking in support at the protest, I was chatting with a nurse who works in Lincoln County, and we were discussing our concerns over the way that Medicaid cuts are going to impact residents of the Central Oregon coast. I believe it was the Congressional Budget Office that said more than 300 hospitals around the country could close directly as a result of Republicans passing the big, nasty, bloated budget bill. And who knows how many clinics, and most of those will be small hospitals and clinics in rural America. A disproportionate amount of folks in rural counties, in red counties, take Medicaid, and hospitals rely on Medicaid to keep their facilities going to pay their staff. So Newport, Oregon has about 10,000 residents, and then you go up the coast a little bit, and Lincoln City also has about 10,000. Those are kind of the bigger cities on the Central Oregon coast, right? Depot Bay, where I was staying, which is in between the two of them, has 1,200 people, right? That gives you a sense. There's lots of little tiny hamlets. And 10,000 is the population centers, and those are where you have the two hospitals, Newport and Lincoln City. My older son was born at Lincoln City Hospital. Now, I know it was 17 years ago, but if it gives you any idea of how rural these hospitals are, Hal was the only child born in the 24 hours that we were at the hospital. I know some of us from major metropolitan areas might not be familiar with the size, the scale of small rural hospitals and how crucial they are when it comes to serving the needs of residents of those counties, of those communities. According to the American Academy of Pediatrics, as of October of 2024, 49% of America's children were on Medicaid. According to Medicaid.gov, 41% of pregnant people are on Medicaid. Medicaid covers 41% of prenatal care and births in the United States. Cuts to Medicaid are devastating for maternity care, for maternity wards in small hospitals around the country. They're devastating for pediatric care. Right? I can't imagine it. We had to drive an hour from where we lived in Siletz to Lincoln County Hospital, where my son Hal was born. My labor was 3 hours long. It felt like we were hardly there before he was born. I can't imagine if that maternity ward had to close. Where would I have had my son? Earlier this morning, I was reading through the Lincoln County Assessment of Access for Healthcare. It's the county-wide report. I know I said in my last video that Lincoln County is a really economically depressed area. So for Oregon, the K through 12, that's the child homelessness rate for the entire state, is 3.7%. For Lincoln County, it's 14.2%. Now, looking at adults in Lincoln County, they are 50% more likely to be uninsured than other Oregonians. With these sweeping Medicaid cuts that are going to give billionaires a giant tax break, I think it's important to understand that it's not just pregnant people, it's not just little kids who are going to be in trouble. I think a lot of older Americans, especially those who voted for and support Trump, are really unaware of how devastating these cuts are going to be for their age group. Because they have not felt the pain of it yet, they may not realize what's coming. Although a recent poll said, 68% of Americans do not feel good about Republicans having passed that nasty, bloated budget bill. A large majority of Americans think it's going to be bad for all of us, which is why the Republicans are trying so hard to gerrymander for the midterms, because they know they have pissed off a lot of conservative voters, definitely all of the independent voters, and of course, they have really mobilized the Democratic voters. So they've got to hurry up and cheat, or they know that they're going to lose. But when we're looking at older voters in particular, so Lincoln County, I know I've talked about population dynamics in the past, and people don't like what I had to say about it. It's not actually good to have a significantly aging population. It's not good to have your population dynamics look like this, right? The youngest people up here, oldest up here, to have it be very narrow and have this shape, not good. But that's kind of what Lincoln County looks like. There are far more folks in the, 60 to 79 age group proportionally than there are in the rest of Oregon or nationwide. The rest of Oregon is pretty stable with kind of an equal distribution, a little bit narrower at the bottom because we do have below replacement. But it's not good to have a very large chunk of folks who are older and nobody else to care for them, especially in the United States where those folks are relying on Social Security. And because Social Security is such a mess, they're relying on those of us who are working to provide for their care through Social Security and Medicare and Medicaid. I think most folks don't realize that it is Medicaid that pays for your elders to be taken care of when they are in memory care, when they're in assisted living or a nursing home. Medicare doesn't cover any of that. Right? Your loved one has to pay, or you, depending on the state and the filial laws there, you have to pay for that loved one to be in memory care 100% out of your or their own pocket. Unless you've done the Medicaid spend down, right? That's why people put their loved one's house in an irrevocable trust. Or if they don't, that's why the government can come and put a lien on their house to make sure that the value of that house covers the cost of their care in a nursing home facility. My dad was in memory care, y'all. It's $9,000, $10,000, $15,000 a month for your loved one to be in a nursing home or in a memory care facility. Medicaid covers that cost for 6 out of 10 elderly Americans who are in facilities. So we're looking at these sweeping cuts to Medicaid and how they're going to be impacting hospitals and clinics around rural America. But I don't think enough people are looking at the ways that long-term care facilities are going to be impacted as well. With the passage of Trump's tax law and all of these sweeping Medicaid cuts, we saw reports that nursing homes nationwide expect to cut 55% of their beds, that nursing home facilities around the country expect to be closing. And those that do stay open will no longer have spaces for Medicaid patients. They're going to be consolidating. It will be pay to play for your loved one with dementia. You want to take care of your granny or your mom full time in your home. It would not have been possible for me to take care of my dad in my home. He couldn't have climbed steps. It would not have been safe for him to be here. It would have been round-the-clock care in a house that was not set up for my dad at all. He needed skilled caregivers in a facility because he was a danger to himself and others and required 24-hour daycare. Who is going to do that work for 6 out of 10 of our elders who are no longer going to be able to get their Medicaid coverage? Again, you may be surprised how many states. You should check and see if your state has filial laws that require you to foot the bill if your loved one can't. So if the federal government, if Medicaid, state Medicaid program is no longer paying for your loved one's nursing home care, and they require nursing home care in multiple states, they can come after you. Even if you're estranged from your parent or your grandparent, they can come after you to foot that bill. And I think we are going to see more and more of that as more elders end up in situations of neglect and where their care needs are not being met because Medicaid is no longer there for them. And it's not just elders, disabled folks as well. I know that we heard from the Trump regime, like, oh, if you have disability, if you are getting Social Security disability, that you'll still have your Medicaid coverage. Please understand that process takes years to go through. It's really standard to just like deny and deny. People are disabled the whole time they are going through the process of trying to get Social Security disability and to be declared disabled. That doesn't mean they weren't disabled beforehand and they relied on Medicaid because they couldn't work during that time. Those people now, under Trump's tax law, are going to be declared able-bodied, and Brooke Rollins, the agriculture secretary, she wants them in the fields, picking cabbage and strawberries. Those folks on Medicaid who need an extensive amount of care are not only not going to have that Medicaid coverage, their local clinics and hospitals where they live across rural America are going to be closing or making severe cuts. Lots of people are going to die from this. So to hear, in this conversation I was having yesterday from somebody who works in a small hospital in a rural area about how worried care providers are, how worried these hospitals are, how unprepared all of America is for what's going to happen to our children, pregnant folks, elders, disabled folks, and also the quality of care and the access to care that is going to shrink for all of us who have health insurance. It's going to be a devastating scene. A lot of people are going to suffer and a lot of people are going to die. That's the reality of what the Republicans have done to us. It just hasn't hit yet. And I guess I want to end here on a hopeful note, as I'm very, very worried about what's going to happen in the coming months and years as a result of these Medicaid cuts. But healthcare was already an abysmal mess for everybody in this country. For-profit healthcare was already killing millions of people. I think now is a time when we can and should be pushing for universal healthcare. We should be pushing for Medicare for all. We are seeing right now the logical conclusion, the final boss of capitalism, of oligarchy, of the for-profit healthcare industry, of the greed of the super rich. So now is a time to reject that model for this country and say we all deserve something better. I think if there has ever been a time in America's history when we are at a pivotal moment where we could start to push for and gain popular support for universal healthcare, now is the time because healthcare is a human right.